Hello, viewers. Hello, good afternoon.
Hi, good afternoon. Can you hear me?
How are you doing today?
Well, I'm good.
Okay, so today's topic is empowerment in recovery. We are drawing inspiration from smart recovery and social work. So before we begin, I would like us to introduce ourselves. Do you want to introduce yourself first, or I introduce myself first?
I don't know what's happening, but I cannot see your camera.
You can't see me up to
I can't
now,
see you yet, honestly.
but I can see you.
Well, I don't know. Okay, it's fine. I think we can just proceed. Perhaps I'll see you later.
Oh, from the audience, please, can you see me? Okay, you can see me. Okay. So you're just listening to my voice alone.
Yeah, for me, I'm just hearing your voice. I can't see your video. But it's fine. I think we can proceed.
Okay, so I would like you to introduce yourself and what you do.
All right. Good afternoon, everyone, or good morning, or good evening, depending on what time zone you're joining from. My name is Chinyere Ndukoye, but you can call me Chi, which is probably the name that you saw on the flyer. I'm a licensed addiction counselor and a mental health coach. And I've been practicing in the behavioral health space for like 4 years. 4 years, yeah. And it's good to be here. And also, I'm a smart recovery facilitator and global master trainer. Thanks, Okwe.
Okay. So what is smart recovery exactly? And why is it important in addiction recovery?
All right. So, smart recovery is actually SMART stands for self management and recovery training. And it's smart recovery is a mutual support model that began in 1994. That's about 31 years now, 31 years ago. It started in the United States with just a few meetings every week. And today we are well in over 35 countries of the world. And the idea of smart recovery is basically giving people access to mutual support. So people who are recovering from all forms of addictive behavior from all parts of the world can connect together and help each other achieve the change, you know, and breaking away from the addiction chain. So yeah, that's what we do. And why is it important? I like to say that the empowerment approach that we use in Smash Recovery is not something that is very popular, yet it is very effective. Many of the outcomes we are getting from our Smash Recovery meetings are showing the effectiveness of Smash Recovery. People are able to make lasting life changes and behavioral changes and able to manage their thoughts and balance life, right? So basically, our slogan in Smart is life beyond addiction. So beyond the addiction you suffered or you are dealing with right now, is there still some other kind of life that's probably better? The short answer is yes. And the how? Smart recovery. Yeah.
Okay, thank you very much for the brief introduction. So I would like to introduce myself too. My name is Adewale Kudirat Opeyemi, as Adewale Opeyemi. I'm a social worker. And who is a social worker? A social worker is a trained professional who helps people overcome life challenges, improve well-being, and improve their health. So today, our topic is empowerment in recovery and why is it important to our work. So, I'll be discussing from the angle of social work and you'll be discussing from the angle of smart recovery.
Yeah, that's
So, for you,
okay.
what does empowerment mean to you in smart recovery?
All right. So empowerment, again, I remember a few months ago, I said that word to a client and the person quickly asked me, empowerment in what sense, right? People hear the word empowerment a whole lot. Financial empowerment, economic empowerment, name it. But I would say in this context, empowerment simply means, know, putting you back on the driver's seat, if that makes sense. Yes. So putting
Yeah.
the person, the client, the individual who is in recovery back on the driver's seat. Oftentimes it feels like the addiction takes over. Probably family even takes over. The behavior consumes the person. And they can't remember the last time they felt in charge of themselves, of their emotions, of their choices. So empowerment in this context, spelling smart, is simply putting the person back on that driver's seat and helping them take charge of their life. So yeah.
Oh, so yes, that is it. Like sincerely, you've shed more light. In social work, empowerment means the same thing as well. It means helping people take control of their life after addiction has taken over their life. It's the rebuilding and reclaiming their lives. So thank you very much. So why is it important in smart recovery?
Why is empowerment important?
Yes, why is it important?
Well, I'll say short answer because it works. It works. We are not just we're not dealing with adolescents, though, yes, of course, younger population could attend smart recovery meetings, but it's because many of the people that we see for addiction are older. That's by older, I mean they're above 15 years of age. And in many countries, that's already legal age of responsibility. Many of them are also above 18 by the time they seek care. So we know that the best way to get an adult to do something is not by telling them to do it. It's by showing them why they need to do it, right? So when an adult feels like the reason for doing this is my reason for doing, I found my own reason for doing this, they are better able to follow through, right? They are better able to plunge in their energy, their resources to make it happen. So empowerment is also very effective because, again, like I said in the other question I was answering, the addiction already leaves this individual feeling helpless for most cases. Many of them feel helpless about their finances, feel helpless about their health, feel helpless about their mental well-being. So what's better way to help the person recover if not by empowering him or her? So whilst a lot of persons might feel like empowerment is probably giving the person the strength that they do not possess, we have often found it to not be so accurate. Because when you tell people you are in charge and they believe it, you see them acting like they're in charge. And that's exactly what we need the person who has an addiction to understand, right? Because when the person understands that they are in charge, you see they're able to manage their emotions. So that's why I would say empowerment is important, especially in smart recovery, because it works, it helps. And again, let me lastly say this. Again, like I said, in Smart Recovery, our slogan is life beyond addiction. So we're not just thinking about the person recovering from the addiction or quitting a certain behavior. It's also about forging a life afterwards that is healthier, happier, more productive, and more meaningful to society. The person needs to feel empowered to do all of that. That's just the honest truth. So yeah, I think I'll just stop there for now.
Okay, thank you very much. So, for social work, em- empowerment is the art of social work because addiction had already eaten the confidence, the lifestyle of many individuals, and so sometimes most of them feel powerless, judged, just like you mentioned. So, in our today's topic, we are talking about empowerment tools. Does smart recovery have tools to empower people, vulnerable people, people in addiction?
Oh yes, a lot actually.
Okay, so will you like to share or it's not okay to share?
Sure. I mean, it's open source, so you can head over to our website at smartrecovery.org and you have access to all the tools actually. Many of them are there in PDF, so you can also download them to your devices for free. So, um, let me just talk about a very popular smart recovery tool, and that's the one we call the CBA, cost benefit analysis. Now, like I said earlier, the one of the best ways to get an adult to do something is not by telling the person to do it. I mean, The person could, but if you want to be more effective, it's by helping the adults find their own reasons for doing it, right? So to say, convince them, right? So the cost benefit analysis, which is CBA, one of our smart recovery tools, enables people to rationally and objectively look at the advantages and disadvantages of continuing in that behavior. So be it gambling, sports betting, pornography, or using drugs. I mean, understanding that it may not be a problem for everybody, right? But if you feel it's a problem for you, to review the advantages of it and disadvantages of using, and then also review the advantages of not engaging in that behavior and the disadvantage of not engaging in that behavior. Now, it can seem very torturous, but at the end of the process, that individual sees a very clear cut picture of why, right? And that's just one of our tools we have, and that tool we also call the 3-question tool. The 3-question tool helps you understand not just setting your goals, so to say. You get to ask yourself, what exactly do I want to do, and is this thing working for me? If it's not working, what do I need to change? Because again, the idea of empowerment is not selling you an idea that is false. It is very practical. So putting it back on the driver's seat is a practical thing within smart recovery. You are going to make it about yourself. I think I said already, SMART stands for self management and recovery training. So if you attend a typical smart recovery meeting, you will not be hearing a lot of talk about how someone else is influencing you, how someone else is affecting you, how someone else is making change difficult for you. You won't hear a lot of that. We don't talk about others. We focus on self a lot. So in a typical smart recovery meeting, you're going to think inward a whole lot. And that is as empowering as empowerment can be, right? So I think I'll just share those tools and stuff for now. Over to you, Okra.
Okay, so if you could ask me similar questions so I
Yes,
could answer as
please.
well.
Yeah,
Okay,
so about
in social
from your own end as a social worker.
okay, in social work, we have tools for individuals and we also have tools for families. So if I'm talking about some individuals right now, so we have a lot of tools in particular. The first one is motivational interviewing. It's about guiding the client or the individual, not directing, just like you've mentioned. So I see when you were explaining, I see that our tools collided with each other
Mm,
because the emphasis is about the individual. We are guiding, not directing them to do what it is. We are empowering them to be who they are. We also have a tool called strength based casework. This is identifying their inner strength, what they can do on their own. And we also have psychoeducation, which I know is in smart recovery as well. Knowledge
mm,
about addiction reduces fear. Yes. So we have recovery plan and goal setting, recovery planning and goal setting, and financial management and crisis support and stabilization. When some clients leave the rehabilitation center, they eventually relapse, or some of them have issues with their families. Is the responsibility of the social work to be able to see, okay, the home the client is going back into. I hope it's not toxic for them. I hope they don't remind them of their failures. I hope they don't remind them of things that could make them angry and go and use. So those are the tools that we use in social work for
mm.
individuals. So before edging on to the empowerment tools for families, I don't know if smart recovery has a different tool for families or not.
Certainly, we actually do have a whole different smart recovery offering that we call Smart Recovery Family and Friends. We also have Smart Recovery for veterans. We have Smart Recovery for youths, right? So yes, we do have for family and friends. And just some of the tools I'm going to share here is most of our discussion in Smart Recovery Family and Friends is centered around a, a global model we call the CRAFT model. And CRAFT stands for Community Reinforcement and Family Training. So what the CRAFT model is not really just a tool, it's a model, right? So it influences a lot of things that we discuss in family and friends meeting. He says that if you have a loved one who is probably involved in addictive behavior, yes, everyone expects that you're going to want them to change. But it's not as easy as it sounds, right, to get them to treatment. So many people who attend our Smart Recovery family and friends meeting get to learn how to use the power of reinforcement, right, to encourage, again, like you said, not force, not show, not teach, to guide, to encourage their loved ones in recovery to seek appropriate treatment services. And that's one. Another important tool that we use in Smart Recovery Family and Friends is a lot of mindfulness, because we understand how difficult it can get for members of family and friends of people in recovery. We have a lot of people who deal with feelings and emotions of guilt and emotions of helplessness. In fact, we've seen a lot of people who fall into addiction while trying to help their loved ones get care for addiction because they are overwhelmed, right? So we use a lot of mindfulness based tools to enable our family and friends meeting participants learn not just how to better support their loved ones in recovery, but also how to live a, I mean, a healthier, happier life themselves too, right? And and that thing is, all of this is all based on the model of mutual support. So it's not like you're coming to these sessions and then there's one therapist or counselor there, teaching you, telling you what to do. You get to speak to other people who also have loved ones in recovery, and then you get to share your feelings. And again, lastly, people in our Smash Recovery family and friends meeting learn how to manage their own emotions, because we know that emotions can make things very dicey. Like you said earlier, that when our clients are leaving treatment settings, there's always this kind of anxiety. Oh, I hope the family will be able to support. They also feel it, right? I hope family will not say the wrong things to me. I hope they will not push my wrong buttons, those kind of things. It's actually not easy because a lot of emotions come into play. But in Smart Recovery family and friends, people learn how to manage those emotions, not let the emotions take the driver's seat, right? But they themselves are in charge, and they are doing what is consistent with their values and their decisions for their life. Yeah.
Thank you very much.
Yeah, sorry, I lost you for a moment.
Okay, so I was trying to explain that in social work we have tools for family as well. The first one is genograms, who help us to reveal patterns across generations for such individuals. We also have family psychoeducation. Most families don't understand addiction, so hereby causing the individuals to relapse more. We also have boundary coaching, how to teach the families that they have to love with limits. When the client keep requesting for money, they need to create a boundary. Oh, I'm not giving you money now, but I can offer help. I can pay for your treatment when you are ready, when you are actually ready. We also have CBT families. Instead of saying I caused it and they will never change, we change the idea that they will change. You did not cause it. It happened. Addiction is a brain disease. We also have self care for families. Some families that have their loved one lost in addiction, they don't care for themselves. They don't even take care of themselves. So they have to take care of themselves. They have to go for their own jobs. Some people abandon their job just to be with, abandon themselves just to be with someone that is addicted, going through treatment with them, and a lot of things. They can't even find their own place. Some people pause their life. So those tools are very important that we
Good.
help families with. Yeah. So final question, ma. So I just wanted to say, I know some of my followers or people out there watching this video might want to know how to join Smart Recovery Family and Friends you mentioned earlier. So how do they do that?
All right. That's a very good question. So if you head over to smashrecovery.org,
I
you're
lost you.
going great. So if you head over to the website smashrecovery.org, you would find a link there or a tab called Meeting Finder. The Meeting Finder lists all our available virtual meetings, online meetings around the world. across different time zones. So you can join the time zone that suits for you. And some family and friends meeting are also listed there. However, if you'd like to join the Smash Recovery, we run from Smash Recovery here in Nigeria, then we're going to have to get across to you with the link and the flyer. I'll be posting it on my profile in a few days' time with the flyer for the meeting and the link to join both the family and friends meeting and to also join the individual meeting. That's the one for people in recovery. Thank you, Okwe.
Okay. I don't know if you would like to share your contact, um, and information to reach you, because some people might like to reach you personally.
Um,
So I don't know if you would like to do that.
yeah, I mean, my Instagram is here. Algos underscore
Mm.
D underscore CHI. So you can send a message.
Okay. So before we close the live, what's your final word for people in recovery, and what is your word of affirmation?
My word of affirmation.
Yeah,
Okay,
personally,
well,
at least that is
maybe
my.
I'll speak from my final words. I would say. So one thing, like you rightly said, addiction is often viewed, especially in most cultures, as immoral feeling. One thing I always tell uh, family members is that your loved one is not bad; they are just sick. Yes, even though this quote unquote sickness has a lot of manifestations that are not so pleasant. So if you're joining this video or you're watching the replay of it and you have a friend or a family member who has an addiction, as painful as it might be, if you keep feeling that they have a moral problem or they are bad people, you're going to feel more frustrated because changing is not just in the will, right? So why can't you just stop? It's not that simple. Addiction is rather a very complex brain disease, like Okwe rightly said, and it takes a lot of different layers of care to help that person come through on the other side. And yeah, those care are available. So that is for you if you're watching as family and friends. And also, one last thing for those who are joining as family or friends of those in recovery is that it is not within your control, right? To make your loved one break out of the addiction. Because oftentimes, because of the pain we feel, like Okpe rightly says, some people even punctuate their lives. Some people stop working, they stop doing the things that matter to them because they have a loved one who is going through an addiction. That is not that is not really very good because the better you are, the better you're able to support your loved one. And so I would say don't let your life stop. Don't let your family routines, your family activities stop. Don't also focus all the attention of everyone in the family or friend circle to that one person with an addiction and then leave other people. Addiction is often a mirror that showcases some sort of pattern that might be available in the family that every other person might be dealing with in a different way. Maybe one person just went the way of addiction or addictive behavior, but others could be dealing with it in their own way. So you've got to leverage that addiction as insight, so to say, to look within the family and ask what needs to change, or what needs to be sustained. However, then also if you're watching this video and you're dealing with an addictive behavior, either addicted to internet or food or shopping or gambling or drugs or alcohol, name it, or who work, maybe addicted to work, I want to say to you, we're fast moving away from that place where mental health is a shameful thing, right? So if it is affecting your life, then keeping it on the inside is not making it better either, honestly speaking. And you don't have to be ashamed. I think it's really good that we're having this IG live public so you know that you are not the only one, first of all, right? So in case you're dealing with an addiction, you are not the only one. Millions of people battle with different forms of addiction. So seeking for help should not be a problem. And as far if help is available. Now, all of them may not be affordable, but one thing is sure, Smart Recovery is free of charge. All our meetings are free. So you can feel free to join. You just have to join with a phone, right? If you have Zoom, you can join on Zoom. And you can join anonymously. And I want to end by saying this word of affirmation to you that change is possible. Recovery is possible. You are not your addiction. Don't personalize it. You are able to live a life beyond addiction.
Thank you very much. Well said. I really appreciate you. So for me to end this live by saying what you can do if you have a loved one struggling with alcohol addiction or drug addiction or whatever behavioral addiction at all, the first thing to do is to stay calm and be compassionate. Avoid lectures, guilt, or shame. Learn about addiction. Take care of yourself. Stay clear of boundaries and seek advice from professionals. Thank you very much, Miss Chi,
Thank
for this life. I really
you.
do appreciate it. Have a nice day. Thank you so much.
Are we taking questions from the audience?
Oh, so okay. From the audience, if you have any question, could you please notify us before we end this live? Anyone from the audience, please? Oh, let me call names. Official underscore YHK. Are you still here? Do you have any question for us? Guva 060. A lot of people came and it left. I'm checking through the Ima is saved. Vcash. Does anybody have a question? Gueva 06. Do you have any question? Okay. With the absence of questions. Okay. Someone just asked the question. How do I undo an aggressive loved one who is not willing to go for recovery? So who is going to answer that among us?
I think we both should speak to you. So maybe you can speak first.
Okay. For me, from my angle, the best thing to do is to seek advice from a trained professional
Mm,
like a psychologist and a social worker. So from their advice, they'll be able to tell if you can pick the person up depending on the level of addiction. We have methods we use in getting clients who refuse recovery. So there are different methods. We can um, use the pickup method,
mm.
or we also, as a social worker, we go to those people's house, the client's house, and tell them one or two things. If we notice the level of severity of the case, we'll have no choice than to pick the person up if there is a guardian that is willing to pay for the service.
That's very,
So
very nice. Okay, can I say
yeah,
something?
yes, please.
Okay, so the reason why I smiled is because this kind of thing happened a lot. More than 80% of people who have an addiction always do not want to go to treatment. It's not convenient, it's not comfortable, it's not exciting. They can't even imagine a world where they are away from family, away from day to day moving around, away from the drug, you know. So let me just say a few things from Smash Recovery that I feel might help. Now, I call it community reinforcement. So if you notice this person is not wanting to go, like Okoradi said, it's not the best is not to keep lecturing because it's going to be like nagging and the person is going to shut you out. So what is best is, if possible, cut off some benefits, right? That could turn the person's attention to the need for treatment, or allow the person to experience the consequences of their action. For example, you are at home and then you set the rule in your house. Everyone comes home by 9:30 p.m. If you're back home after 9:30 p.m., you're going to sleep outside. Now your loved one returns maybe later because they are away using drugs or engaging in a behavior that is addictive. They break the rules. Don't make adjustment. Don't make allowance. Don't try to be soft, right? Don't try to accommodate them. Actually, you have a word for that, enabling. Don't enable them, right? Allow them to suffer the consequences of their actions. Now, maybe, for example, you agree as a family, you're using substances, we know your money is going into it. Going forward, we're going to slash your allowance by this percent. Keep to it. you are not directly asking the person to go into treatment, but you are reinforcing the need for treatment. In other words, you are not rewarding the addictive behavior. So the person is going to start counting the cost, and they would actually start to consider treatment. So I feel that or approach might also be important for you to keep in mind, depending on which one you feel is more appropriate. You can try the crisis method, or you can also try this reinforcement method. Thank you, Okwe.
Thank you very much. Very insightful. Thank you so much. Any more questions? Mm, no more questions here. So official underscore why is K brand. I hope we answered you correctly, or you got a message from our answer. Thank you very much. So we'd like to end this live. Thank you for joining. I really appreciate it. This live is not going to be a one-off thing. We are going to do this over and over again. Thank you, Miss Chi. God bless
Thank
you.
you. Thanks for
Yeah.
having me here. It was a good chat.
Yeah.
Bye, guys. Stay good.
Bye.